As a doctor or nurse, Gentu provides the option to reorder and prioritize your default patient tab, where you can go straight into the clinical tab rather than having to review the patient's details first. Within the patient's record, click and hold the clinical tab, then drag to the left so it sits in the first position. Once you have applied this will remain until you change it back. Please note that this is a user-specific setting. In the Clinical tab, Gentu provides some additional clinical information panels over on the right-hand side that often gets overlooked and not utilized. The first panel, Patient Notes, is where you can record temporary notes such as social notes, for example, patient going to Japan in December, or patient is into photography, or patient's family history notes such as dad has diabetes, mum's name's Mary, or patient is 6 months pregnant, and treatment reminder notes, things to discuss at the next or subsequent visit. Latest measures allows you to simply enter in the patient's height, weight, BMI, and blood pressure. Whereas the adverse reactions is where you go to add in your allergies. Click on the plus button, then search for the allergy in the agent field. You do not need to select one from the drop-down list. To save what you have typed in, simply press Tab. Enter in the manifestation if known, and mark the severity, then followed by Save in the bottom right. If you want the allergy to be flagged as an additional alert, hover your mouse over the allergy and click on the flag icon on the right. This will show the allergy in pink at the top of the patient's card, and it will also print out on the theatre list that you send to the hospitals. The last panel that we're going to talk about is the diagnosis. Many doctors will say they normally record the patient's diagnosis as part of the consult note or letter. However, by specifying the diagnosis here in this panel, all the patient's current conditions will be visible on the main clinical tab, and it won't require you to go searching through the consult notes or letters. Click on the plus to enter in the diagnosis. Enter in the name of the diagnosis. If it exists in the list, simply select, or alternatively, press Tab on the keyboard to save the word or phrase you have typed in. Enter the onset month if known, and then click on Save.